Hi, I'm going to show you today whether your hip is part of your back problem. So if you have a restricted hip joint, it's going to change the way the position of the pelvis lines up. That's going to stress the back out. So the first thing you want to be able to do is, can you lie on your back when your knees are up like so? Drop one leg down and try to drop the hip out as far as you can. If you can drop it to the floor, this is what I like to term the child's hip. So if you can try both sides, can you drop the other leg all the way down to the floor? In an arthritic hip, you're up in this position and you won't be able to go much out to the side. You'll be stuck there. Whereas the other side will be completely floppy. So what we want to do is to lay in what we call the figure of four position, and we're going to just try and let that stiff joint gently drop out this way. Sometimes if it's a capsular restriction, in other words a soft tissue stretching, tension in the hip, we can just lie there and it'll drop away and gently settle. Sometimes it'll be arthritic and get stuck there. You need to try and relax this inner abductor muscle to let it go. Another way to do this is to lie on your front and exactly the same position. What we're trying to do is squash that hip down in that position there. You can change the angle of the hip, bring it down that way, but the objective is to try and flatten out the body so that your pelvis is flat across the floor. That's one of the typical restrictions in an arthritic hip. The other classic restriction is abductors and adductors. And the way you can stretch those is on my hip video. Thanks. Hope this helps.